Mosquito nets, vaccines, and a global race. Can a new shot finally tip the scales in the centuries-old fight against malaria?
Today is May 26th, 2025. Let's start with the basics. Last year, the World Health Organization endorsed the RTS malaria vaccine for broad use. That set off the biggest malaria vaccination campaign in history, right?
Yes, that's right. RTSS is now being distributed in 17 countries where malaria is common. Malaria still kills over 600,000 people each year, mostly young children in sub-Saharan Africa. So seeing this vaccine roll out at scale is a huge milestone after decades of research finally turning into real impact.
What about the R21/Matrix M vaccine? Both are approved by WHO, so why bring in a second one?
That's a good point. Both vaccines are safe and effective, but their rollout strategies and supply chains differ. RTSS was the first, and it showed a 13% reduction in all-cause child mortality and a 22% drop in severe malaria hospitalizations. R21 came later, but its efficacy in trials is similar. Having both means there's more supply, more countries can participate, and it helps guard against any production issues with either vaccine.
And on the ground, how do these numbers translate? Are we actually seeing a real drop in malaria cases?
Yes, we are. In the first year after vaccination, both vaccines cut malaria cases by more than half, especially when children get the full schedule, including a fourth dose in their second year. In places with highly seasonal malaria, combining the vaccine with chemoprevention can reduce cases by as much as 75%. By April this year, 19 African countries had added one or both vaccines to their childhood immunization programs, and at least 30 plan to do so.
Those numbers are strong. But what about the practical side? Supply, funding, and acceptance. What kind of hurdles have countries faced?
Supply was a real challenge early on. There wasn't enough RTSS available. So WHO and Gavi set up an allocation framework to prioritize the highest-risk children. Funding came from Gavi, UNICEF, national governments, and others. It's a big investment, but compared to other interventions, the cost per life saved is low.
And what about trust? Getting people to accept a new vaccine isn't always easy.
Absolutely. Building trust was key. Health agencies ran pilot programs to show the vaccine was safe and actually worked. Community engagement mattered. Local leaders, health workers, and education campaigns helped parents feel confident. Integrating the malaria vaccine into regular childhood immunizations also made it seem like a normal step, not something experimental.
Now that both RTS-S and R21 are available, is supply still a bottleneck?
Much less than before. R21's approval eased a lot of the pressure. It means more countries can get vaccine supplies, and the pace of rollout has really picked up. There's still work to do, but things are moving faster now.
Taking a step back, how does combining malaria vaccines with other tools like bed nets and chemoprevention change the overall approach?
The evidence is strong. Combining these tools saves more lives than using any one alone. Studies show up to 70% fewer malaria deaths and hospitalizations when vaccines are layered with bed nets and seasonal chemoprevention, compared to chemoprevention alone. It helps make sure each child is protected by at least one method, sometimes even several.
Is this approach a test case for future disease control strategies? Could we see similar models with other diseases?
Yes, definitely. Malaria is showing that vaccines and established tools can work better together, not just side by side. The same thinking could apply to other diseases, like pneumonia, diarrheal illnesses, or even future pandemics. It's about layering what works and adapting it to local needs.
So beyond the immediate impact, this is really a proof of concept for coordinated, multi-layered public health strategies. Do you think this will help close health gaps globally?
Yes, the burden of malaria hits the poorest and youngest the hardest. Rolling out these vaccines with fair access and community trust shows how health gaps can be narrowed. It's a real-world example that could guide other global health efforts.
That's a clear lesson. This isn't just about a vaccine, it's about cooperation, problem solving, and real progress against a disease that's been with us for centuries.
We've covered the science, the rollout, the challenges, and the larger lessons. The malaria vaccine story is still being written, but its impact is already historic.
Thanks for joining us as we explored the malaria vaccine rollout, its on-the-ground impact, and the bigger lessons for global health.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.